My name is Ariane Gozon. I'm going to be your nurse practitioner for today. Could you tell me why you're here?
For a physical assessment.
Okay, great. I'd be glad to help you out with that.
Alright.
Let's start with a mini mental status exam first. Could you tell me your name
My name is Sean Gozon.
and your birthday?
It's 7/25/1992.
And where are we at right now?
In the clinic
Yes, and which state are you in?
in New York.
Yes. And then tell me the date today.
It's April 30, 2023.
And what's the day of the week?
It's Sunday.
Who is the President of our United States?
President Joe Biden.
And then this is just for me to test your recall. I'm gonna say 3 things for you to remember.
Okay.
I would want you to repeat it so you could remember it.
Alright.
And then at the end of the exam, I would ask for you to repeat those 3 things.
Okay.
And the 3 things that I would like for you to remember are fish, ball, and orange. Could you repeat that for me, please?
Fish, ball, and orange.
Okay, so keep that in mind, alright? Alright, so let's start with the vital signs. This is to measure your blood pressure. Okay, just relax for me, okay?
Okay.
Very much. I'm just gonna get your pulse rate. I'm just gonna feel for your respiratory rate. Okay, your respiratory rate is normal. I counted it as 16. Your pulse rate is also normal. I counted it as 88. However, your blood pressure is a little bit high. It's 130/88. And, we could talk about it later as soon as the exam is done, okay?
Alright.
Alright, we can start with checking your skin. I'm just right now feeling for your skin. Your skin is warm to touch. Feel your skin turgor is normal. You don't feel or seem dehydrated to me. Your skin color is appropriate for your ethnicity. Now we're gonna have to go to your head to toe examination, okay? If you could
Okay.
just bend your head for me. I'm gonna check for your scalp. I don't see any infestations. I don't see any lesions on your scalp. Your head is normocephalic, it's atraumatic. Your hair distribution is average and it's symmetrical. Okay, if I do this, does it feel tender to touch?
No.
No tenderness to palpation. Now I'm going to inspect your face. If you could face me. Yes, your face. I don't see any excessive hair growth or hirsutism. I don't see no edema, no lesions. I'm going to palpate for your temporal artery here. Okay. Your pulsations are 2+. If I touch over here, any pain?
No.
No pain on palpation. Right. Now we're going to move on to your eyes, okay? Your eyebrows are symmetrical, they're midline. Your eyelids, I see that your eyelids, they're normal. I don't see any edema or discharges or swelling, no retraction or protrusion of eyelids. I'm gonna push down over here so I could see your conjunctiva. It's moist and pink. I'm gonna move it all the way up as well. It's moist and pink. I'm gonna push down here on your lacrimal system. Does it hurt?
No.
No discharges on the lacrimal system. His cornea, his pupils, I don't see any deformities, no visible abnormal findings. Your conjunctiva is anecteric. Your sclera is anecteric. I'm going to shed a light into both of your eyes, and this is to test for any pupillary reflexes, okay? Just look straight towards me. Right, great. Right. Your pupils are both brown, brisk and round, and they're both reactive to light. I'm going to test for accommodation skills. If you could just stare directly at the wall that is behind me right now, and then after that, you stare quickly into this pen. Okay. No nystagmus there. Both of your pupils are reactive to accommodation. We are going to test for your confrontation skills, okay? Tell me if you see my fingers on your peripheral vision.
I see it.
Yes. How many fingers do I have up in the air?
2.
Okay. Over here?
2.
Okay. Over here?
2.
Down here?
1.
Follow this pen light with your eyes, okay? Okay. So your cranial nerves 3, 4, and 6 are all intact. This is an ophthalmoscope, so I could take a look at your retinal vessels, okay? I'm gonna shine this light into your eye. One more time. So your red reflex is intact. I didn't see any AV nicking. I didn't see any hemorrhages or exudations. Your physiologic normal to disc, your physiologic disc ratio is normal. Your macula is also present. This is called a Snellen's chart, and this is to test for your visual acuity. I would want for you to cover one of your eye and read the letters on the fine line that you see.
On the last one?
Yeah, the finest letters that you see.
L, T, F, P, H.
Yes, and then do it on the other side.
L, T, F, P, H.
Yes, and do it on both of your eyes, please.
L, T, F, P, H.
Great. Your visual acuity is 20/20. Now, do you still recall the 3 words that I asked you to remember?
Yes.
Okay.
Fish,
Yeah.
ball, orange.
Yes. Great. All right. Now we can move on to the nose. Before, I'm also gonna have to use my scope so I could take a look at your nasal vessels. But before that, if I touch here, does this hurt?
No.
No. Okay, your nose is midline. I know that. I'm gonna pull your head back. Yes. Okay. So your nasal membranes are intact. You don't have any deviation, or I didn't see any polyps. no redness, no swelling, no drainage. So that is good. Your nasal membranes are pink and they are moist. Now let's move on to your mouth, your lips. I see that they're, I don't see any cracking. They're deeply moisturized with the lip balm. Could you open your mouth for me, please? Sorry. Okay. Your dentition is complete. Your buccal mucosa is pink and moist. Could you stick out your tongue for me? Say ah. Your uvula is there, it's midline. Your tonsils are not enlarged. Your tongue is also midline. Move your tongue to side. Yes, and then pull it up. Okay, great. Great. I don't see any abnormalities. So that's good. Now let's move on to your ears. Okay. Before we use the otoscope that I have, let's move on to the rubbing fingers, okay? Could you tell me if you hear my fingers rubbing?
Yeah, both ears, yeah.
Both ears up till now?
Yeah.
Okay. This is called the Weber and the Rhine test. This is a tuning fork that I would have to put one on the top of your forehead, and you should tell me if you hear the sound on both of your ears. And two, I would have to strike this and put it behind your ear, and then you tell me as soon as you stop hearing the sound, and then I would have to turn it to the other direction and then tell me when you've stopped hearing it, okay?
Yeah.
You hear it on both ears?
Yeah.
Tell me when you've stopped hearing the sound.
There. Yeah, so there.
Tell me when you've stopped hearing it.
There.
Okay, great. Now let's try on the other side of the ear, okay? Tell me when you stopped hearing it.
There. Yeah, I can still hear it.
Tell me when you've stopped hearing it.
Okay.
Yeah? Alright, great. Remember, is midline, air conduction is greater than your bone conduction. So that is good. Your hearing acuity is also intact. Now we're gonna have to go to check your membranes in your ear, okay? Okay, if you could turn your head to that side. I'm pulling it up and back. Okay. I see your cone of light. I don't see any perforations on your tympanic membrane. No lesions, no discharges as well. Your auricle, I don't see any lesions or masses or, nodules, no abnormalities. If I touch behind your ear, does it hurt?
No.
No. Same as here on this side. Does this hurt if I pull down?
No.
No. I don't feel any nodular tenderness. Does it hurt here behind you? Okay. And I'm just gonna check for your ears, okay? Okay, you pull it up and back. Yeah. So that's also the same. Close your eyelids at this time, and then I would try to open it, but try your best to fight my hand resistance, okay? Alright, great. And then smile for me. Clench your teeth. Okay. And then puff your cheeks. Yes. Frown. I'm gonna palpate for your temporomandibular joint over here. Does this hurt?
No.
No? Okay. Maybe open your mouth for me. And then clench your teeth one more time. Okay. No clicking, no popping in this area as well. This is, I'm gonna put this, well, I want you to close your eyes, okay? And then I'm gonna place this cotton buds on your face, and you tell me if what you're feeling is soft or dull. For reference, this is soft, and then this is dull. Okay?
Okay. Soft. Dull. 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 Soft.
Yes. Great. Your trigeminal nerve is intact. Now we go to the neck. Okay, I see your neck. I see any pulsations there, no obvious deformities. Your neck is symmetrical, it is supple. Okay, I would just like to test for the range of motion on your neck. If you could touch your chin, put your chin to your chest and pull it back towards up the ceiling. And then pull it side to side, lateral, lateral, touch your chin to your shoulders, to the other side, and then rotate it. And then to the other side as well. Yeah. Okay. I'm just gonna feel for your lymph nodes, okay? So this is your pre-auricular, your post-auricular, your tonsillary, maxillary, submental. Okay. And I go down here. This is your superficial cervical chain, posterior cervical chain, deep cervical chain, and then your supraclavicular. Any tenderness?
No.
No. Okay. I see your like look up for me. Yes. Can you swallow? Yes. So I see that swallowing is visible. Your trachea is midline. I don't see any deviation from that. I'm gonna go right behind you so I can feel for your thyroid gland. Okay, and then just swallow for me. Okay, thyroid gland. It's palpable, but also I don't feel any nodules, no enlargement of your thyroid gland there. So that's good. All right, now I'm gonna test for the strength of your neck. Okay, I'm gonna push your head or your neck like this. I'm gonna place my hand, and then I just want you to push against my resistance. Ready? And the other side. Yes, you're very strong. 5/5 neck muscle strength. I want you to shrug your shoulders. Okay, and then I'm gonna ask you to, fight my resistance. Okay, push it up. Great. All right. So now, let me just palpate for your carotid arteries. It's 2+, it's not bounding. I'm just gonna take a quick listen. Okay. All right, that's good. I didn't hear any bruise or thrills. Right, now we're gonna move on to the chest, okay? Okay, seeing it from this perspective, I don't see any retractions or bulging. His AP lat diameter is normal. Now I'm just gonna have to feel for your chest and see any tenderness that you feel. Do you feel any?
Mm-hmm.
No? Alright. Now this is the test for any consolidation, okay? There's 3 parts to this exam. The first one is to test for or palpate for tactile fremitus. I would want you to say 99 for me.
99, 99, 99, 99.
Yes. Okay. This is called egophony. Okay. Every time you would feel my stethoscope touch your skin, I would just want you to say E.
E, 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 E.
Okay. Now the next test is called whispered pectoriloquy, where I would want you to whisper 99 every time you feel my stethoscope touch your skin.
99, 99, 99, 99, 99, 99.
Okay, great. Okay, this is to test for any diaphragmatic excursion, alright? I want you to take a deep breath for me. Do it one more time. Alright, take a deep breath for me and hold it, okay? 1, 2, 3, deep breath. Okay, hold it, hold it. Alright, and then exhale. Alright, your diaphragmatic excursion is about 4 to 5 centimeters, and that is normal. Alright, now I'm just gonna percuss your lung fields, alright? And then every time you feel my diaphragm going to your skin or my stethoscope go to your skin, just breathe deeply for me. I'm gonna listen to your breath sounds. Great. I didn't hear any abnormal breath sounds. I'm just gonna check your back since you're already exposed. Your back is already exposed at this time. I'm pressing on your spinal muscles. Does this hurt at all?
No.
Okay, great. No tenderness on palpation. Does this hurt? No costovertebral angle tenderness. All right, great. Now, if you could face towards me again, and we're gonna check for your anterior chest. Thank you very much. Okay. So his chest is elliptical in shape. I don't see any retractions or any bulging. I'm gonna just do what I did with your posterior chest and your anterior chest, okay? So I'm just gonna touch over here. Does this hurt?
No.
No chest, anterior chest wall tenderness. I'm gonna start percussing, okay? Okay, resonant on percussion, and then I'm just gonna listen. Okay, breathe deeply. Okay, breath sounds are clear. We're gonna move on to the cardiac part of the exam, okay? I'm just touching over here. These are all my four auscultatory landmarks in your cardiac exam. This is the aortic area, which is located on the second ICS on the right sternal border. Your pulmonic area, which is on the second ICS on the left sternal border. Your Erb's point, which is on the third ICS left sternal border. Your mitral valve, or your mitral area, tricuspid area, sorry, which is on the fourth ICS left sternal border. And your point of maximal impulse, your mitral area, is on the fifth ICS left mid-clavicular line. If you could just lean forward for me. Yes, I hear your mitral area there. I don't hear any abnormal heart sounds, okay? Now I'm just gonna listen to your heart sounds, okay? Okay, upon palpation, I didn't feel any heaves or thrills. Upon auscultation, using my diaphragm and my bell, I also didn't hear any extra hard sounds. Your S1, your S2, they are there, they are present. Other than that, I didn't hear any more extra or abnormal heart sounds. I didn't hear any murmurs.
It's cold.
I'm sorry.
It's fine.
Okay, so I'm checking for your lower extremities. I don't see any edema. I don't see any ulcerations. Your cap refill on your toes is less than 3 seconds. Also on your upper extremities, I don't see any edema or any ulcerations. All right, I'm just gonna feel for your pulses at this time. For your brachial pulse, your radial pulse, your popliteal pulse, your posterior tibial pulses, and your dorsalis pedis. Yes, they're all 2+. I'm gonna listen to your major arteries in your belly using the bell of my stethoscope. Okay, and then I'm gonna go all the way down to your inguinal area so I could feel for your femoral pulse and listen to your femoral pulse, okay? Sorry. Okay, great. So all your pulses to me are 2+, they're normal. Your aorta, your iliac arteries, your renal arteries, your femoral arteries, I didn't hear any vascular bruits or any murmurs. So let's go inside so I can examine your belly. Your belly is soft. It is flat to not non-protuberant. Okay, I'm gonna listen to your bowel sounds. Your bowel sounds are normoactive, okay? I'm just gonna lightly palpate your belly. Does this hurt?
No.
Okay, and then I'm gonna do a deep palpation. Tell me if this hurts. Okay, I'm gonna percuss, okay? I'm gonna start percussing. And then I'm gonna percuss for your splenic sign, okay? Let me just do that again one more time, okay? Okay. Feel for your spleen. Does this hurt?
No.
Okay, spleen is not palpable. Okay. Now next I'm gonna have to do your liver scan. Liver span, this is about like 7 centimeters. Okay. And then I would just ask you to walk from here where I'm standing to the end of the table. Just walk at a normal stance. Okay. And you can come back. Okay, great. It's good. So your gait is normal. You have an even, steady gait. Your base is wide, and that is also normal. Your posture is good. Walk on your toes. Okay, and then coming back, walk on your heels. Yes, great. Now this is called, we did the Romberg test. This is called a tandem test, okay? Where you would walk as if you would put your foot on the other like this, and then put another foot like that, okay? So just do it from here to the end of the table. Yes. Okay, great. That's good. All right, so now this is just a test for your cerebellar functions, where I would like for your heel of your foot touch your shin from your knee down. And then do the other side. Yes, great. Close your eyes. This is to test for your position of balance or sense of position. Both of your feet together, and then, yes. And then I would time you for 15 seconds, and I would just like for you to maintain that posture for 15 seconds, okay? All right, great. That's good. Now this is called a pronator drift, okay? I would ask for you to close your eyes, put your palms to the side, level of your shoulder.
Feet together or no?
Yes, feet together is fine. Level of your shoulder, palms up, okay? And then close your eyes, and I just want you to remain in that position for 15 seconds. Yes, great. So you don't have any pronator drift. Now that your hands are up like that, I would just want to test the strength of your hands, of your shoulders. So just put it like that. I'm going to push it down, but I want you to fight my resistance, okay? Great. So we did your neck, right? I'm going to palpate for your shoulders right here. Does this hurt? No. No tenderness on rotator cuffs. All right. Great. I want you to flex and extend your shoulders. So put your arms forward and then like maybe face towards me. Yeah, and then put both of your hands to the side. Clasp your hands up and above. Yes, and then down. Extend your hands backward. Yes, great. And then from there, reach for your scapula on the back. Touch your shoulder blade. Touch your shoulder blade over here. Over here, touch it all the way up, and then do it on the other side. Yes, and then touch your other shoulder blade behind your head, and then do it as well on the other side. Yes. And then let me see your elbows. Let me just feel for your elbows and see. Does this hurt when I push? When I touch?
No.
No tenderness on the elbows. I want you to flex and extend that elbows. And extend, supinate, and pronate. Yes. Now let me just feel for your wrists. Put it down. Put both of your hands down. Let me feel for your wrists. Does this hurt like this when I push?
No.
No. Move your wrists like that. And then deviate it to the left and right. Okay, and then let me feel for your fingers. This hurt?
No.
No. No. Alright. Now let's just do a hand grip strength. Grip my hand as tough as you could, stronger as you could. Yes, great. And let's do a thumb opposition where you would touch your fingers with your thumb at a time, one at a time, and then do it on the other side. Yes, great. Yeah, so we did that. Let's go to your hips. If you could please lay back down so I could just take a feel for your hips. Does this hurt when I push?
No.
No. No tenderness on the hips. I'm gonna have to flex your hips, okay? Flex it all the way up to your chest and extend. And then do a number 4. Okay. And then we'll do it on the other side. Flex and extend. And then do a number 4. Right? Okay. You could stand up, you could sit up, sit back up. Okay, and then flex your knees one more time. Yes, and then extend it all the way back. Extend your knees all the way back. And then your ankles as well. Does this hurt if I touch your knees like this?
No.
No? None. Okay. And then I'm gonna touch for your ankles. Does this hurt?
No.
Okay. Does this hurt?
No.
No, I'm touching for your toes. This hurt?
No.
This hurt?
No.
Alright. And then I want you to plantar flex and dorsiflex your foot. Okay. And then rotate it. Rotate, and then the other side. Alright. Now I want you to push down the pedal while I fight you, and then push it up while I fight you. Great. Same thing as well in here. Push it all the way up. Okay. And same thing as here. Push it all the way up. Yes. And then I'm gonna push, push, push. Fight it. Fight it, fight it, fight it. Great. Push, push, push. Okay. And then, yes, pull. Yes. Great. Alright. Now I would want you to stand up again one more time. We're going to test your back muscles. Okay. I want you to bend over, touch your toes all the way. Yes. And then extend your back all the way to the back like this. Yes. And then side to side. And then rotate those hips as well. Yes. Yeah. Great. Motor. This is a test for your oculomotor. I want you to identify all the scents that you could smell.
Grapefruit, oranges, lemon.
Yeah, it's very citrusy. So your oculomotor is intact. We did your optic. We did your. No, sorry. That was an oculomotor. That was olfactory. We did your optic, your oculomotor, your trochlear, your abducens, your facial. We did your trigeminal nerve. We did your acoustic. We did your glossopharyngeal and your vagus nerve. We did your spinal, your accessory, and your hypoglossal. To touch and feel a girl's vagina so heavenly. Yes. Your upper extremities to see. Do you feel any pain?
No.
Do you feel any pain down here?
No.
No. Do you feel? I want you to close your eyes and identify which area of your body I am touching.
My upper thigh.
Yes. Is it your right or your left?
My left.
Yes.
Right thigh.
Mm-hmm.
Left inside elbow.
Yes.
Right elbow.
Yes.
Left foot.
Yes. Okay. Now this is the same test as what I did in your face, wherein you tell me if it's what you're feeling is a sharp or a dull. Okay. This is sharp, and then this is dull. But this time I'm not just gonna put it on your face. I'm gonna put it on both of your upper and lower extremities. Okay.
Sharp. Sharp. Dull.
Yes.
Sharp. Sharp.
Yes.
Dull.
Yes.
Dull.
Mhm.
Sharp.
Mhm.
Sharp.
Yes. Great. Okay, so this is called the finger to nose test, where you would touch your nose and then you would touch my finger and you would just follow where my direction of my finger is. Okay, so touch your nose. Okay, touch my finger, touch your nose, touch my finger.
And don't look at the finger.
Yeah, don't look at the finger. And then touch your nose, touch your finger. Okay, so close your eyes.
Yes. Yeah, a little bit. Yeah, a little bit.
Okay.
Yeah. Yes.
Okay, great. Your vibration sense is intact. And then now we'll just test for your reflexes. Okay, so let's see. This is for your brachioradialis, or your brachial. This is for your brachioradialis. This is to test for your triceps. This is to test for your patellar reflex. And this is to test for your posterior tibialis. Relax, relax. Okay, and then this one is to test for your plantar Babinski reflex. Okay, that's normal. That's normal that you would draw. I'm gonna test on the other side. Okay. And then I'm gonna test here. Relax. Okay. And I'm gonna test here. Relax. Okay. At least you know
That's
that's
strong.
intact. Okay. I'm gonna test here. Here. Okay, and then we test for. I will place
3 different objects in your hand, and I would like for you to identify them. Okay?
Car keys.
Car keys,
Nail cutter.
nail cutter,
Lip balm.
yes, it's a lip balm. Okay, and that concludes our physical exam. Thank you so much for your participation.